Well, welcome, everybody. So good morning, good afternoon, good evening, wherever you are in the world. And welcome to this webinar, Patient and Public Involvement in Research in Brazil. My name is Gary Hickey, and I'm chair of the International Patient and Public Involvement Network. And before I introduce our two wonderful speakers, I'm just going to do a little bit of housekeeping. Ricky, if I could have the next slide, please. Um, Please do say hello, first of all, within in the chat function. It's really nice for us to know whereabouts in the world you are, because we are an international movement. So it's really good to see the different countries and different parts of the world that you're from. Um, your microphones will be muted for the duration of the presentation, indeed for the whole webinar. And this, of course, is to prevent background noise and interfering with people's enjoyment of the webinar. You can turn subtitles on or off by clicking on the show and hide captions at the bottom of your screen. But please do ask questions throughout the presentation, or as many as you would like to. And you can put these again in the chat function that should be at the bottom of your screen. Because we've got our speakers here, we'll be speaking for roughly 25, 30 minutes, and then there'll be a chance for Q&A, and I'll keep an eye on those questions. One of the things that I want to say is that we will be recording this session, and everybody that has registered will receive a copy of that recording, and it will also be on the International Patient and Public Involvement Network website. So without further ado, I'm going to introduce our two speakers. We have Egmar Longo, who is a physiotherapist and professor at the Federal University of Paraiba. And I'm sure, Egmar, you'll tell me I pronounced that incorrectly and put me right, and that's fine, obviously in Brazil. And Egmar leads EPP Brazil, which is a national initiative focused on advancing patient and public involvement in research. And Egmar is joined by Luciana Pereira, who's a project coordinator at Projeto Cura Institute. And again, Luciana, please do correct my pronunciation. And Luciana works to promote public involvement in clinical research and improve access to understandable scientific information. And both Egmar and Luciana are very much at the forefront of developing patient and public involvement in research in Brazil. And in this webinar, they're going to give us an overview of patient and public involvement in Brazil, and indeed share their experiences. So without further ado, over to Luciana and over to Egmar.
Thank you so much, Gary, for introducing us. Hello, everyone. It's amazing to see everyone from all different parts of the world. So thank you for attending. So then we'll start the presentation. Egmar, do you want to share or do you want me to share?
Yes, I will share it, no problem. Hi, everyone. Can you see the presentation? Okay.
Yep, loud and clear, yep.
Yeah, so good morning from Brazil. I'm seeing some colleagues from our country, so we are very happy, and the same different parts of the world. So it's a pleasure for us to share some of our hard job, to bring the PPI to Brazil. The roadmap of this presentation includes, first of all, talk a little about ourselves and present some PPI trainings and resources in Brazil, and cases or experience of PPI initiatives, and finally discuss about barriers and facilitators to embed PPI in Brazil. So I'm Brazilian. I'm a PT, a pediatric physiotherapist, a proud mom of Charlotte, and I'm a very curious person. And I'm passionate about travel and learn from different contexts and culture. And I'm coffee love, and I love to have good conversation with people, especially in different parts of the world. Luciana, it's your turn.
Yeah. Hi, I am Luciana. So I am also Brazilian. I'm from Rio. So whenever you guys want to come to Rio, happy to give you tips about it. I'm a chemical engineering by training, but I'm really passionate about science since I was little. I am Taurus, so just a curiosity. And I am a mom of two, Gabriel and Beatrice, and I'll speak a little bit later. Love to travel, love to go to the beach, and love to meet people from all over the world. So that's a little bit of me. Okay, next one, please, Egmar.
Sure. We are talking on behalf of a huge team of incredible and wonderful women in Brazil that are passionate about the PPI, and together we are doing a lot of effort to implement PPI in Brazil. It's a shame that Luciana is the only partner from the public because we are starting this movement. So we have a lot of research in this group, but we are only counting on Luciana to support our job here in Brazil. So most of us, we are working at public universities, and we have some students from PhD, master, and undergraduate programs.
Okay, so I'll start a little bit. I won't go really deep into my story, but I think it's really important to understand why I got involved with research, right? Because what a chemical engineering is doing here, I am not a health professional. So these two guys, these are my kids, not kids anymore. Gabriel is 26 years old and Beatrice is 23. And I have this photo. They gave me the permission to share because they are adults now. So that's really important also to mention. And Gabriel, he was diagnosed with diabetes type 1 when he was 1 year old. And I had to get the best care that I could. And then Beatrice, when she was 11 years old, she was diagnosed with a rare disease, a rheumatic disease, which is called SJIA. In kids, in adults, it's Still's disease. So SJIA means systemic juvenile idiopathic arthritis. And she was also diagnosed with MIS, which is the macrophage activation syndrome, that can be lethal if not treated like urgently. So it was really, really hard to see. They are both chronic diseases. In this QR code, you have a little bit more detail. It's an interview that I did. It's in Portuguese, but you can have the subtitles in English where I tell the story because only the story will be kind of a whole presentation. But they are both doing great. They are both in, like, Gabriel is managing well his diabetes and Beatrice is totally remission. She's now into science too. So she's doing her master's in biochemistry. So we are a science family. Okay, can you go to the next one, please, Egmar? So, and I love this slide because, the moms, so we always in science, we always talk about evidence, right? And then what about mom's advice? So it was very interesting to see a pediatric rheumatologist to post this in Mother's Day that she had, some science evidence, and then she puts the mom's advice as the strongest evidence known to mankind. So what I used to say is that a mom, you are the specialist of your own kids. Sometimes we can exaggerate, I know, but we really know. We spend some time with the doctors or researchers or the health professionals, 1 hour at the appointment, at the medical appointment, but then we are 24/7 with our kids, or if you are the one that has the condition, like you know your body or you know your kid. So just to give you this idea. And it's not easy when we have to decide in other people's life. So it is really hard when you have a little kid, when you have a 1-year-old, and then you have to decide what treatment you will do. So just to exemplify this. Okay, the next one, please, Egmar. And then from my personal experience, I had a lot of help. The first one that inspired me was endocrinologist, Dr. Rogerio Vivaldi. And he was the one treating Gabriel, and he told me that I had to study, that I had to get materials to give him the best care that I could. So I got some books in the US at that point. And then I was reading everything about diabetes type 1 to get, because he was a baby. So I wanted to have the one that could have the less amount of blood, because I had to pick him like 5 or 6 times per day. So he was the first one that gave me this help. And then I had a lot of help from some foundations when I was trying to look for a treatment for Bia, because she was very refractory, and at the end she had to do a bone marrow transplant to get into remission. And only around 100 people in the world did this to treat this condition, the SJIA. As I had a lot of help and I'm in a good place now, so I came back to these foundations that you can see on the bottom, like Projeto Cura Institute, Systemic GI Foundation, Acredite, and Agregar. And I work as a volunteer in these foundations, helping people, helping other people with the same conditions or different conditions. Let's say Cura is about oncology, so I never had cancer, but I do understand about research, and I do understand about patients, and I do understand how to communicate with patients. So now it's my turn to help and support, because I had a lot of help. The next one. And here we
Yes, it's from my
finally.
side. I would like to start sharing how this work in Brazil have started. In 2020, I started to work with Zika children, and we would interested in to learn more about the perspective of these families. And we start with qualitative research with photo voice, and we start to be nearest to PPI initiative. So we do some collaboration with UK researchers that were working with public partnership, and I started to do some course and learn more and being contagiated with PPI approach. And a couple of years later, I met Luciana because we were working only with researchers here in Brazil, and it was impossible to work with PPI only with researchers. So when we met Luciana, we could start to talk properly about PPI. So what we are doing in Brazil, we start with some knowledge translation strategies, because we would like to spread the message about PPI in a very plain language, and in the same time in an attractive and friendly way to captivate people with this approach. So after my postdoc in Exeter University, when I came back to Brazil, we start with these projects where write ebooks, and we start with this one in about concepts on PPI, and we wrote in Portuguese and we translate into Spanish and in English. And after that, the people loved the material and they asked for more information and how to restart with PPI initiative. So we run the second ebook. We invited a lot of colleagues from UK, Canada, the Netherlands, Uganda, Chile, and ourselves here in Brazil to count about some practical experience doing PPI. So now the second ebook, we only have it in English, but we are translating into Portuguese because it's our language. I think the main project that we are running here in Brazil is the PPI schools. We ran the first one in 2025 here in my university in João Pessoa, Paraíba, and we trained 30 researchers because we know that we have started uh, with small steps, and it's a PhD thesis from my student, Kaline Jesus, and we don't have any financial support, and we decided to have like an itinerant school so we can move with the team and with the methodology aspects to other parts in Brazil. So we moved from northeast of Brazil to south of Brazil, and we run the second PPI school at UDESC. It's a University of Santa Catarina, where we trained more 30 research there, and we are open to visit other parts in Brazil to train more and more and more and more people. Luciana, it's your turn.
Yeah. So this is the second initiative that we are working here in Brazil, and I'm very proud to be part of this course too. This is a course from the McMaster University in Canada, which is called Family Engagement in Research. And I did this course in Canada. It was an online course. It's a 10 weeks course. And then we have a partnership with the McMaster University because Paula, the first one there in the picture, in the photo, she went to Canada, and then she got this partnership for us to translate and adapt to our culture this course. So it's a 10 weeks course. And it was very interesting because this course you can have, it's not mandatory, but we try to have half of families and half of researchers together. So the training already starts with both of them working together. And at the end, we have, the end of the course project where they will work together and they have to present some materials about PPI. So we had 19 families and researchers trained last year, and we'll do another round this year too. And this is our team, the instructor teams. And this is for free. This is all for free.
Another initiative, it was the Inova Café, EPP Brazil. It was this idea came from Exeter University. I had the opportunity to have a consultation with the PPI Ideas Café. It's a partnership between Exeter University and NIHR, where they provide some, in a very informal space, remotely, some tips about how to involve people in research. So it's the other part of our strategy in Brazil. One thesis is to training researchers with the Innova Café. Part of the second project is to training public members to work in partnership with academic researchers. So in this part of the Innova Café, we are offering free time from a team including Luciana. Luciana is training other public members to work with us in this project. The people are very interested in have this kind of conversation because they are passionate about to start to do PPI, but most of them don't have any idea in how to start with this new approach here in Brazil. We also working with translations of important material to building capacity of Brazilian people here in Brazil. The first material that we are translating is toolkit from Pakistan, led by Timo Topa, and we are also translating the NIH UK standards for PPI. We have finished the easy read material, and all this job we are doing in partnership with public members as volunteers. Luciana?
Okay, so now we'll start with the practical cases. And then we have the research cycle on our left side, just for you to give an idea, because sometimes when we start, we are not able to involve the public in every step of the research, but involving in some steps is better than in none. So this is the way I think. Like it's better to have in some steps than not to have it at all. So this is a case, this is a publication from the Projeto Cura Institute. So this foundation, we are focused only on research, in oncology research. So that's what we want to bring awareness, what we are trying to get funding to these type of research. And we had one of the meetings, is called Cura meetings, where we bring together all the stakeholders that can discuss about clinical research. So we had oncologists, we had CROs, we had AROs, healthcare decision makers, CONEP and Anvisa, which is our regulators here in Brazil, public members and NGOs too. And we were discussing about the research barriers in Brazil. So out of this meeting, we had this publication, and what I highlighted here is the public members that are highlighted in blue, and the ones in yellow are the regulators, because it's really important to also to have them in these kind of meetings. So they are all authors of this paper. So this was a really important example of how society and how public can organize a meeting, because it was all organized by us, including the resources that we had. It was in an oncology conference in Brazil. Yeah, so this is what I wanted to mention about this case. And this was like here in the cycle, we can see this after defined one research question. And it was a dissemination of a work of a meeting that we had. And then after this meeting, so one of the conclusions is that we need to understand if patients, if they do understand about clinical research, if they do understand about clinical trials. So we designed a survey to cancer patients, and after also to oncologists too, but I decided to put the one from patients here, where we had a survey specific for people that were in clinical trials, and another just for a patient that was doing, let's say, the normal treatment, to understand what they knew about research. And it was very surprising because some of the patients, they didn't even know that they were part of a research. They knew that they were being treated, but they didn't know that they were in a clinical trial. So then we have this publication too, and we were involved in all the steps, all the phases of the research cycle, including getting financial support for the research. Okay. And now I'm very, very, very proud to be organizing this. It's the patient committee, which we call like Cura Conecta, which is cure. Cura means cure, to cure. And we are just starting this. We had 2 meetings where we'll have patients and member of the public together to decide about some training, some public training, to get some materials with plain language for people to understand about research, to understand about oncology, because in Brazil, we really need to talk about clinical research. People don't understand. Most of the people, they really don't understand. That is important, how it's important to have the research. And we also want to identify barriers, how we can get better, how we can reach out to all people, like from different different cultures. Brazil is a really big country, so we'll have a patient committee, and then we can support the researchers if they have some research that they want to involve the public. Okay.
So another initiative that I would like to highlight, it's about the PPI group from the Brazilian Cerebral Palsy Register. It was an initiative from the Global LMIC Cerebral Palsy Registers. And when this project started in Brazil, we don't have PPI involved, so we don't was discussing with them about this project. But just after the project was started, we create the group with 2 adults with cerebral palsy and 6 mothers of children with cerebral palsy when it started. But now we have a lot of people, different people with cerebral palsy contributing in the PPI group. I think it's one of the most more active PPI groups here in Brazil. They work a lot together, building things together. And I show one of these products that they had created. It was a comic book. It was in Portuguese, in English, and in Spanish, counting and showing how they are working to build different materials, informative materials, infant-friendly format about what is cerebral palsy, and especially how they are working to build this register in our country. The other project, it was the Participa Brazil PPI group. It started when I was doing my postdoctorate in Exeter in 2023. And I invited some mothers and people with cerebral palsy to work with me to think about new projects, and especially about how to have more friendly questionnaires to inform the life of children with cerebral palsy in our country. So one of these initiatives, it was a great project where we work together with mothers of children with cerebral palsy and a professional illustrator that we created picture about the items of the PPI. It was a questionnaire to explore participation of children with and without disabilities. And these families would like to have their children representing at each item of the community. So they are building this. I think we have 10 remotely meetings to have these final pictures where their children are representing in each of their picture, including myself here. So it was a lovely project in partnership with families. The other example, it was a scoping review of another PhD student where we conducted a scoping review on participation of children with CP in partnership with these people, including adult with cerebral palsy and two moms. So it was a very interesting partnership that we have enjoyed a lot during the process. So I would like to invite to Luciana to comment about the problems that we have to implement PPI in Brazil.
I will just answer a question that John Gardner did on the chat, because I think it's really important also to contextualize this slide. So in Brazil, we have a public health system and a private health system. So we have both, okay? Public health system is completely free. Everyone has the right to use, even if you have a health insurance and if you're using your private system. And 75% of the population is using the public system. We are a huge country. We are more than 200 million people. So, and this is what we call SUS, which is SUS, and it's an amazing system. We have a lot of difficulties for sure, but comparing that, Brazil is a huge country and we have a lot of issues. It's an emerging country. So just to give you, the context of how we have the health system in Brazil. So of course we have some barriers to implement PPI. And the first of all is limited funding for PPI activities. As I was saying, our country is an emerging country, so sometimes it's really important to have access to medications, and when people sometimes they forget about research, and that research is also important. So we need to keep going and to keep going to the government and to explain to them that this is really important, that research is important, that the PPI is important. And also one thing that I did is I went to the ethical committee to help them too, because it's not only for me to talk bad about it, but also if I can support, I'll go and support. We also have a formal institutional support. This, we hope it will change because now we have a law to talk about clinical research, and the system is kind of having different strategies. So we really hope that this will get better. We have limited awareness of PPI among researchers, which we are trying to also to reach out with the courses. A few training opportunities in Portuguese too. So that's why we're generating a lot of materials and training materials. And we also have to train and to talk about and bring awareness about clinical research before starting to talk about PPI, because some people, they don't even understand what is clinical research. And as I was saying, we are really a huge country, so we have some geographic and social inequalities that we need to try to reach to everyone. So probably the way we are going to do training in the south is part of the Brazil is not the same that we'll do on the north. We'll have to adapt the training and all the material, because if not, you won't be able to reach out these communities. And we also have limited reimbursement mechanism for public contributors. So this is really difficult because there are some ethical barriers too, which we are kind of trying to discuss this too with the government and try to make them understand that this is really important. Yeah.
Yeah, in the other side, we need or we must mention it that we are very brave people here in Brazil because all of these aspects, especially these geography and social challenges, we need be strong, and we have a very strong tradition of social participation through the SUS, that is our NHS, and we can see a huge growing of the culture of patient and community organizations in different states in Brazil. And we are doing a lot of effort to have partnerships and collaborations from colleagues with more experience on PPI, as we have mentioned before. And we are building a national PPI network as EPP Brazil, that we are inviting more people to work with us and spread this culture in Brazil. We are very proud of the initiatives, including capacity building as schools of PPI, fair course, and starting with Innova Café. And we also are seeing a lot of wish and desire from public members to do partnership with us. They would like to learn how they can contribute. So this job in partnership with Luciana to train peer to peer, it's a very important part of step of our future strategies. Yes, I think is it, and I invite Luciana to finish with lessons learned.
So we learned a lot. Like, I know we have been preparing these materials and the training and the schools for a long time, but all the things that like happened, they happened since 2024, right, Egmar? Like the
Yes,
actual
yes.
schools. So I think 2024 was a great year for us, and 2025 too. And we are still keeping the work now this year. So I think with the resources that we have, we made the possible and the impossible, doing to work with PPI and getting public involvement and getting patient involvement too. So we had all these initiatives. So we had the Innova Café. We also think it's really important to have international partnerships because, we don't want to reinvent nothing. Of course, we have to adapt to our culture, but we need help of people that are already doing PPI in different countries and to learn from them too, like really to have an exchange and partnerships and everything. As Egmar was saying, the public is coming little by little and really they are really curious and they really want to work together with us. The first meeting of the Innova Café was great. I was there with the patients, and they really want to learn. They really want to understand and to contribute. So it's amazing to see. Patients organizations are also being really involved. So whenever you want a patient to be involved, the best way for you to try to get someone, it's through the patients organizations in your country or in different countries. So always be connected with the patients organizations. We are doing Portuguese resources. Everything is kind of digital too, because it's easier for people to access. And we hope that we'll have more resources to keep doing the PPI schools because it involve a lot of people and it has some costs. So we are really trying to get some funding to that. So but we'll keep moving, and we keep doing the best that we can. Yeah, so that's our Brazilian journey.